Pointless, useless, fad or scam products are not new, but today it is easier than ever for people to create and sell such to unsuspecting victims like you and me. Well-executed ads and marketing materials touch on pain points or on issues which we resonate with. By using empathetic videos, images, audio and text, our attention is earned and we are often convinced into believing product X can ease or solve these issues. We are lured in and we ultimately decide we need to buy. Unfortunately, if and when the product arrives, it isn't often quite what we expected. There are many dental products that promise unrealistic results with little effort. In this video, we share 8 of them. We share their claims, explain why you should avoid them, and recommend an alternative. DIY mouth guards for grinding. What are they? Coverings for the teeth. They are often made from a soft thermoplastic and are designed to be removable. To assist with grinding, they are to be put in your mouth before falling asleep. In most instances, these DIY options are made without doing an impression of your teeth, but may be adapted using a boil and bite technique as opposed to those that are custom made to your specific teeth by taking an impression. The claim. They claim to help prevent tooth wear caused by grinding in your sleep and can also prevent or cure jaw pain associated with grinding too. Why you should avoid. Tooth grinding associated with jaw pain or other problems is known as bruxism. Whilst it is true that wearing a professionally made night guard can protect your teeth against tooth wear caused by grinding, there is mixed evidence about how well they reduce jaw pain. There is no evidence to support the effectiveness of generic mouth guards for managing jaw pain. Wearing a mouthguard overnight does not come without risk and shouldn't be considered without seeing a dentist to exclude any other conditions such as a jaw fracture or change in bite. A significant problem with a poorly fitting night guard is that it is a choking hazard. Even those that need impressions aren't problem free. Recommendation. If you have jaw pain, book in with a dentist to make sure grinding is the cause. They can advise you whether a night guard will be beneficial to you and can provide you with a custom-made mouthguard that fits you and meets your needs. They can also discuss all the alternative treatments available. Rubber band straightening or gap bands. What are they? A form of DIY orthodontics where elastic bands are used to bring teeth closer together. People use conventional orthodontic elastics, hair elastics, or unregulated orthodontic gap bands around 2 or more teeth to move them. The claim. The claim is that the pressure from the elastic will push the teeth together, so there is less of a gap. They are advertised as a cheaper alternative to getting braces and an option that doesn't involve seeing a dental professional. Why you should avoid. All orthodontics carry an element of risk. This includes damage to the roots of the teeth, the gums, and a change in your bite. Tooth movement, which is not closely monitored and controlled by a qualified professional, can result in loose teeth. These mobile teeth can be irreversibly damaged and can actually die off in some circumstances due to the trauma of tooth movement. The tooth nerve can be damaged, causing the tooth to die, and then requiring root canal treatment. Often these do not have good long-term survival rate though, and some will need to be removed. Also consider that you are only going to move the teeth that have the elastic band around them. There is the potential to create gaps on the other side of these teeth instead. Long term, teeth are likely to drift back to their original position unless you have some sort of retainer. Recommendation. Don't use rubber bands to close gaps in your teeth. Seek advice of a dental professional to discuss your options to change the appearance of your teeth. Mouth guards to improve your jaw and facial structure, also known as myofunctional orthodontics. What are they? These are soft plastic coverings for the teeth that are not specific to your mouth or teeth. The plastic covers both the top and bottom teeth at the same time and prevents them from fully meeting. They are designed to be used while you sleep. They are placed in the mouth before going to bed and are not worn during the day. The claim. These types of braces claim to change the alignment of your teeth and the shape of your face. They do this by changing the way your muscles in your face move and changing the places where they put pressure on the teeth. They advise that these devices help correctly position the tongue, which they correlate with improved breathing and jaw structure. Promises made by the manufacturers include realigning teeth, improving teeth crowding, crooked teeth, overbites, expanding a narrow arch and reducing tooth gaps, improving the structure of your face and jaw, eliminating double chins, breathing better, reducing snoring. Why you should avoid. As with all DIY orthodontic options, these companies send the braces directly to you, and so you have no discussion with a dental professional to diagnose accurately and consideration of alternative treatments. This seems to be following the theory of myofunctional orthodontics. There is minimal research on this topic and its success is debated amongst orthodontists. The small amount of evidence in favour of these types of appliances suggests they should be used during periods of growth, e.g. in childhood and adolescence, and not as an adult. For most people, internet-bought aligners like these will have no long-term positive effect. Poorly fitted plastic mouthguards like these can also cause trauma to the gums and cheeks, as well as being a choking hazard. Recommendation: avoid internet-bought mouthguards that promise changes to tooth alignment and face shape. Anything that holds medical claims should be registered as a medical device and requires a prescription from a healthcare professional, doctor or dentist. Visit a dentist to discuss any concerns you have with your smile and they can fully explain all options available. Online tooth straightening. What are they? These are clear plastic trays known as aligners that are sold directly to patients without seeing a dentist or orthodontist. You take an impression at home or attend an appointment for a scan of your teeth and are then sent a number of clear plastic braces which will change the arrangement of your teeth. The claim. The companies selling online teeth straightening promise to permanently change the appearance of your teeth by moving their position. Because they are made of clear plastic, they are not immediately obvious when you are wearing them, so are an alternative to conventional fixed braces or train tracks as you might know them. And they claim to be cheaper and more convenient too, as you don't need to visit a dentist. Why you should avoid. Before starting orthodontic treatment, you should have healthy gums and teeth. You should not have any sort of treatment with braces if you have active tooth decay or gum disease. These companies do not check your teeth before starting, and so you might have untreated dental problems. X-rays should be taken before any treatment to move teeth. These can only be done at a dental practice or hospital. Whilst all orthodontic treatment comes with an element of risk, this risk is likely to be significantly increased if you have not had a full clinical examination prior to commencing treatment. There is the potential for irreversible damage to your teeth and gums. Another risk of orthodontic treatment is that it can lead to a change in your bite. Where this is not closely monitored by a dental professional, long-term damage can be done, including jaw pain and tooth wear. Recommendation: proceed with caution when choosing direct-to-consumer orthodontics. We recommend treatment that has full involvement of a registered dental professional, but also understand that online teeth straightening is one option available to you. Before starting any treatment, we would advise you book in to see a dentist to discuss the concerns you have with the appearance of your teeth. They can also check that the teeth and gums are healthy before you start any braces treatment. If you are going to have online braces, click the link in the description that will take you through to our accompanying article that gives more information on what you can do to help ensure safe treatment. Snap-on veneers. What are they? These are removable plastic covers that clip over your teeth. They are made using a model of your teeth and are designed to fit only you. Other common names for them include removable veneers, instant smile, clip-on veneers, snap-on smile, or instant veneers. The claim. These claim to be a quick way to change the appearance of your smile without needing to see a dentist. They cover up teeth you don't like and fill gaps where teeth are missing. They are advertised as a cheap and quick alternative to cosmetic dental work. Why you should avoid. The use of snap-on veneers can cause irritation to the gums. There is also the possibility that they can cause tooth decay by trapping food and plaque. Often the product does not look as good as you would expect. They are made of one piece of plastic which has a dull, opaque colour that does not look like natural teeth. They can be bulky too, causing a lisp or even difficulty moving your lips naturally to smile and eat. Some brands are still expensive for a product that is unlikely to last beyond 18 months. When we compared the prices of a leading brand with professional alternatives, the price differences over a 5 to 10 year period were not as great as you may think. More than anything, ordering these does not give you a chance to ask questions about all the options available to you as an individual. You don't get to ask if these will solve the concerns you have, and because the people who make them are not regulated in any way, you are not protected if anything does go wrong. Recommendation. We advise against direct-to-consumer removable veneers because of the potential harm to your teeth and gums. We recommend you visit a dentist to have a discussion about your specific concerns and come up with a personalised treatment plan depending on your needs. Ultrasonic tooth scalers. What are they? Battery-operated handheld cleaners with a sharp tip that vibrate to remove plaque and tartar from the teeth. Other names for them include home scalers, dental scalers, and tartar removal instruments. The claim. They claim to remove tartar and staining from the teeth similar to professional dental scaling, but without leaving the comfort of your own home. Some say that using their scalers will make the teeth appear whiter and improve your oral health. Why you should avoid. These do not whiten your teeth. It is not possible to lighten the overall colour of your teeth without professional whitening. The biggest problem is that they are ineffective. You cannot completely remove tartar or calculus from your teeth at home because the bond to the teeth is too strong. Some may remove staining, but not always, and not without risk. Risks include trauma to the gums from the sharp metal tip, gum irritation from high temperatures of the fast vibration rate, especially because there is no water flow, scratching the enamel surface if used incorrectly, damage to existing dental work such as white composite and metal fillings, crowns and veneers too, infections in the gum by using non-sterile scalers. Recommendation. Avoid them. Try to keep your teeth and gums clean with a good at-home oral care routine. If you have a lot of calculus build-up, see a dental professional for a scale and polish. Mouthpiece toothbrushes. What are they? A relatively new style of dental health product that cleans all the teeth at the same time. You place the moulded mouthpiece cum brush head in the mouth and bite into it. The mouthpiece is attached to a handle or handpiece that sits outside the mouth. The handpiece includes the motor that moves the bristles in the mouthpiece to clean the teeth. Whilst mouthpiece toothbrush is one name for this type of electric toothbrush, they are also referred to under many other names, including mouthguard toothbrush, automatic toothbrush, U-shaped toothbrush, or hands-free toothbrush. The majority are U-shaped and cover all the teeth in the mouth, but other styles exist. Some cover just one arch of teeth, and there are J-shaped or half-mouth options too. The claim. They claim to clean all the teeth quicker and to a better standard than most people do with a regular manual or electric brush. Because all three surfaces of your teeth are cleaned at the same time, it does reduce the amount of time you need to spend brushing. And because the bristles are positioned at the ideal angle, it should reduce the number of brushing errors, because the human element has been removed. Why you should avoid. The problem is that they simply are not effective at cleaning. They're not yet good enough to replace conventional cleaning with a manual or electric toothbrush and interdental cleaning. We know because we have tried quite a few. Cleaning with a Mouthpiece toothbrush leaves plaque on the teeth and gums. This plaque is what is responsible for tooth decay and gum disease. They don't come in enough sizes to suit different jaw shapes, and the bristle alignment is often bad. Our findings are supported by at least 2 clinical studies, both of which do not advise using such products. One study found that the use of a particular U-shaped brush to be no more effective than not brushing at all. Simple brush is the best we have tested to date and could prove beneficial for specific individuals, notably those with disabilities or limitations in their ability to clean their teeth. Recommendation. As you might expect, we advise against them for now. Simple brush is the best performing product to date. The cleaning results are impressive if used correctly. You need to master the technique to achieve good results. Even then, it still falls short of the standard required to replace a regular toothbrush. Unless you have seen reliable evidence that they work as claimed, you should stick to a regular manual or electric toothbrush. We do believe this type of toothbrush could well be the future, but currently they are not good enough. Whitening kits. What are they? Products available over the counter or online that whiten teeth. This includes whitening gels, whitening pens, whitening strips, and whitening lights. The claim. Sellers claim the products will make your teeth lighter in colour. They claim to get similar overall bleaching effect on the tooth without custom-made trays and without seeing a dentist. They advertise themselves as being cheaper than professional tooth whitening and more convenient as they could be delivered straight to your door. Why you should avoid. Whilst the rules do vary from one country to another, tooth whitening products are very closely regulated in the UK. This is because if the correct precautions are not taken, or if unsuitable products are used, whitening can be painful, dangerous, and harmful to your long-term health. Chemical burns, blisters, and ulcers are all problems that can happen when whitening treatment goes wrong. Swollen lips are also another potential side effect of dangerous tooth whitening. Legally, over-the-counter products cannot contain more than 0.1% peroxide. This is insufficient to lighten the tooth colour and so will not be effective. Peroxide products prescribed to you by a dentist are up to 6% hydrogen peroxide or 16% carbamide peroxide. This is 60 times stronger than the over-the-counter products and is efficient at lightening the tooth colour. In the USA, for example, the rules and strengths are different. Much higher percentages are allowed. It is also illegal for anyone other than a qualified dental professional to carry out tooth whitening if the whitening agent contains more than 0.1% peroxide. Whitening lights that you put in the mouth, usually with blue LEDs, are ineffective. At best, they dehydrate the teeth and give a limited whitening effect. They don't change the colour of the teeth, despite what the adverts might suggest. Recommendation. For fast, effective and safe results, book an appointment with your dentist, who can make custom moulded trays. They can ensure your teeth are healthy enough to be whitened. Ultimately, you have the decision to pick and use whatever product you choose, but we would rather you pick a product that you can be assured will work, and very importantly, be safe and won't put your teeth and general oral health at risk. As it stands, far too many products pose unnecessary risks and are a waste of your money and resources. Some may suggest we are critical of products so that dentists and the dental industry don't lose money from people treating their own teeth at home. It's not an unreasonable assumption to make, but it simply isn't true. If we were to promote such products, we can make a lot of money from the commission. But that's not what we stand for here at electricteeth. We have a strong code of ethics and want to do what is right by people trying to look after their oral health. We are as impartial as we can be. We are not selling dental services or receiving any financial compensation for promoting the profession. Any information given in our videos aims to help people safely look after their oral health without spending money on gimmicks and fad products, which can often be dangerous. Click the link in the description for lots more information on the claims and dangers of these products, along with further advice on alternatives and what to do if you are unsure.